how we do things within Atlantic Canada, how we work with our healthcare professionals to bring some of the best practices to each and every province. So once again, it really comes down to sharing information. And we recognize too, and I think it came up quite often, that there are some things that we can actually do without the federal government, but we must be patient-focused, and we must be committed to improving health outcomes.
And we need our partners in the system to be able to adapt. As you know, the way we deliver healthcare today, the way doctors practice is different than it was 16 years ago when I started this job. But we need our partners. We need the College of Physicians, we need the nurses unions, the other organizations who are part of this, to come with solutions. Allow the full scope of practice to be practiced. So a nurse practitioner needs to be part of the solution. Family practice nurses need to be part of the solution. We just broadened the scope of pharmacists in Nova Scotia. All of them need to be allowed to practice to their full training. But that will only come to fruition if those other organizations allow that to happen.
I think what we're trying to bring forward here is we have to take a different look at the issue from a different perspective through the eyes of the patient, through the eyes of the community providing the care, and in the process of doing that, actually helping us recruit and retain healthcare professionals for the long term.
The other one which is important for us is a recognition that when you look at domestic homicide violence, and over the last 10 years, we have seen some 66 victims that we have in Atlantic Canada, and unfortunately, most all of them are women. So we put in place a coordinated Atlantic Domestic Homicide Review Network. And what this would do is we'd share information between Atlantic provinces and jointly consider what would be existing system responses to prevent these homicides, identify partnership opportunities with research, and the role that our academic institutions can actually play in coordinating some of the best practices.